Hi, a very good afternoon, everyone. My name is Zhihan, a research assistant from SSR. In our last webinar of this year, we are pleased to have Ms. Natalie Chia and Mr. Bruce Liu from the National Council of Social Service share the findings and implications of the Social Service Sector Survey 2021. We are also thankful to have Dr. Justin Lee, Senior Research Fellow from the Institute of Policy Studies, moderate this webinar. I'll first make a few announcements before I hand my time over to the speakers. First, we are streaming this webinar on Zoom and recording the session live on our SSR Facebook page. We will upload the recording on Facebook after the webinar. By participating in this Zoom webinar, you consent to the recording and for SSR to use it for publicity. For Q&A, you may post and vote for questions via our Pigeonhole link in the Zoom chat. Once the Q&A session is open to the floor later, I will also allow the audience to use the raise hand function if you wish to turn on your camera and unmute your microphone to ask your question directly. However, we will not be taking questions from the Zoom chat and the Facebook comments section. As we have a limited amount of time for Q&A, we apologize if we are unable to take all questions. Our upcoming 13-week mentoring program on research skills for social services from January to April next year is open for registration until the 22nd of December. This training program by SSR includes a 2-day workshop followed by mentoring sessions with our Senior Research Fellow. If you are interested, please scan the QR code on the screen to find out more about the training program. With that, I'll now pass my time to Natalie, who will start with the first presentation. Thank you.
Hi, everybody. Thank you so much, Jihan. Give me a second while I share the screen. Is everyone able to see the slides? Great. Okay. So thank you so much, Jihan. Hi, everybody. As Jihan said, I'm Natalie. I'm from the Translational Social Research Division in the National Council of Social Service. And many thanks to Jihan and the team at SSR for having us at this session. Also good to see fellow colleagues in the sector and some familiar names in the attendees list, so welcome. So the Translational Social Research Division, or TSRD for short, which I'm a part of, is essentially the research unit in NCSS. And some of our colleagues work on longitudinal research studies or studies on administrative data, whereas the immediate team I'm in is focused on more sector-facing research. So we cover quality of life studies, which had actually been presented at this platform a few months ago, as well as public attitude studies towards persons with disabilities, persons with mental health conditions. So the study today we're sharing, the Social Service Sector Survey, is precisely part of these more sector and public-facing studies. The Sector Survey, or SS21 in the 2021 version for short, is something that NCSS has run regularly every 3 or so years. And in its recent form, we've run it twice. So the findings today are from the 2021 version, with comparisons to 2018 where relevant. So maybe I'll just share a bit first on the methodology to get everyone started. Okay, so the survey is comprised of 3 modules. One is directed to SSAs focused on, meaning social service agencies focused on organizational effectiveness. And then there are also 2 modules directed to the public and corporates respectively. So both of these modules focus on the funders or the public's perception of the sector and their involvement in it. The survey is conducted during pandemic time, so December 2020 to May 2021, and the exact timing varies according to which module. For the SSA module, which is on the left on this table, we had close to 150 ED responses out of NCSS members, which is close to about 450, as you can see here, it's 459 members at that time that we had run the survey. So the profile of our respondents was broadly representative of our membership by subsector and size of organization, as I'll show in a later slide. In terms of members of the public, we ran the survey largely via online panels, also telephone-assisted interviews with N equals 2,000 Singapore residents, representative of the local resident population. And for corporate funders, we recruited individuals to participate in our survey from our internal list and also via online panel. So as I mentioned earlier, the SAC sample is broadly representative of our NCSS membership in terms of subsector and size of organization via total operating expenditure. In this sharing, I'll split the presentation into two parts. So firstly, I'll focus on the funders and general population funding. We'll touch on it quite quickly, but I'll spend a bit more time on the SSA module, which is also going to lead nicely into a sharing with my colleague later, Bruce. So the general findings from GenPod and funders, I'll run through that first and then also briefly touch on the summary of the findings for SSAs. So perception of the sector-wise, overall, it has been positive in this 2021 study. We have observed improvements since 2018 in the funders and GenPod module. And in terms of overall participation and sector involvement in the sector, for GenPod, we see an increase in causes supported and also increase in amounts donated, as well as volunteering frequency among certain pockets of the population. So I'll just touch on a few of the salient findings based on the module later. For funders, there's also room to engage them more in sharing of technology or skills that we'll share later as well to raise SSA's capabilities and also in areas such as hiring persons in need. For the SSA module, SSA see improvement across different organizational effectiveness facets based on their ED self-ratings, especially in providing options to meet service users' individual needs, using data evidence effectively, and engendering innovative, transparent, and learning organizational culture. And then in terms of some of the areas that we see SSAs identifying as future challenges, human resource management, of course, and financial management, such as sustainable funding, were cited as future challenges prompted by SSAs that they anticipate they'll face in the next 3 to 5 years. Okay, so I'll just touch on the funders and GenPod findings first, starting first with the perceptions of funders and the public. So we have in this slide the findings from both the funders and GenPod on a series of statements where we ask respondents to rate their agreement on these statements relating to their perceptions of SSAs. So the statements, for example, maybe social service agencies rather are trustworthy, or that social service agencies are reliable. So looking at the general population findings, which is on the left-hand side, among members of the GenPod, their perception of SSAs appears to have improved compared to the 2018 study. So respondents rated their agreement to the statements that I mentioned, and we focused on the proportion who agreed or strongly agreed to these statements. And we see that there are significant increases across almost all these comparable items between 2018 to 2021. In particular, 8 in 10 agreed that SSAs provide important services to meet the needs of the vulnerable. This was the top statement. As for a statement that had the greatest improvement in perception, 15% of the public now more agree or strongly agree that SSAs have governance structures to prevent fraud. Among funders, you see their findings on the right-hand side. We did ask a similar set of questions and again show the agree or strongly agree responses. So compared to GenPod, we have higher rates of agreement, especially for statements about SSAs being reliable, effective, trustworthy, and have governance structures to prevent fraud. Moving on to involvement in the sector, for GenPod first, close to 9 in 10 of our sample are engaged in some kind of philanthropic activity at least once a year. So the main forms that we had sampled on, that surveyed on, were volunteering, meaning volunteering to SSA. So we did specify volunteering to a social service agency at least once a year. Another form would be donating money through payroll or donation in kind or donating money outside of payroll. So as I mentioned, 9 in 10 had been engaged in some kind of activity at least once a year. And compared to the past 1 year, we also found that 19% had donated more outside of payroll, and a similar proportion also claimed to volunteer more compared to a year ago. Briefly touching on the funders' involvement, the chart just shows the frequency of involvement that they had in various forms of philanthropic activities. But note that, of course, the sample was based on organizations that are already engaged in the sector. So we're more looking at what's the distribution of different types of activity. So those that we had surveyed on included donating money, but also donating in kind, volunteering through organizational volunteering, or engaging SSAs for the services, such as through sensitivity training, or even engaging SSAs to help with coaching of peer support specialists, for example. And finally, what we wanted to draw attention on was, I think there's also an opportunity to involve corporates more in terms of beyond giving and volunteering, in particular transferring technology and skills to enhance the capabilities of SSAs. And in fact, Bruce here has been working very much on the digitalization of SSAs, among other things. But if you wanted to find more about some of our initiatives in that regard, and also how corporate could get involved, perhaps we can hear from him more on that later as well. So I'll move on to the SSA module. So the SSA module is primarily based on a framework of organizational effectiveness domains. We developed this in consultation with Prof. Lam-Swee-Sam back in 2018. Also went through FGDs with SSAs to develop the domains and items. So the domains are listed on the left. So they include, for example, board or strategy planning, human resource management, so on and so forth. How the SSA module worked was that SSAs rated their agreement on a 7-point scale to a series of questions in each domain as a gauge of their effectiveness in that particular area. Then we calculate a mean score for the domain, which is plotted here, and a higher score of 7 denotes more effectiveness, basically. So between 2018 and 2021, we do observe a general increase across all domains of AE, which is based on the ED self-rating. This was especially so in areas of HR, culture, service quality, and similar to 2018, we see that fundraising remains one of the weaker domains. To look closer at what items are driving the increases, so we present in this slide the top 10 increases in perception of organizational effectiveness based on the agree or strongly agree responses to the constituent items of the domain. So I flagged the domains at the bottom here, and then these are the individual items. So what we present here, these are all statistically significant increases with 95% level of confidence. And we see jumps around 20% plus in leveraging technology to increase efficiency within the organization. So this jumped from 49% to 73%, as well as seeking new solutions to solve existing problems, which jumped from 58% to 80%. Encouragingly, we mentioned fundraising engagement was one of the lower rated domains as a whole, but there is a 21% increase in one item in developing an effective brand marketing and comm strategy. We saw that using data or evidence effectively to make informed decisions also improved by 20%. When we looked at which size organizations which were also driving increases, we did find that it's primarily medium, meaning agencies with 1 to 5 million in total operating expenditure, or very large, meaning above 10 million, that seem to drive most of these increases. So as you can see on the slide, we have denoted which of the sizes of agencies saw the particular improvements. I'll move on to the next slide then. In the previous slide, we looked at increases. So this slide, on the other hand, shows the lower rated items based on the proportional agree or strongly agreed to the statement. Collaboration within the sector, for example, or we also had an item on forming strong partnerships with the private sector was one area that was flagged with as a lower rated item. Research and data, collaborating with other agencies on research on the eval of services and programs, or even conducting research on service users' needs or issues was also all the lower rated items. And as you can see on the left-hand side, which would be the lowest, would be fundraising and engagement items, such as my agency is able to obtain new funding streams without much difficulty. My agency is able to grow in the organization and revenue, or has committed funding to sustain and support growth. To the earlier slides, they gave us a sense of SSA's perceived competence in different organizational effectiveness domains. To gauge how they would prioritize the different OE domains, we asked them hypothetically, if they were given 100 tokens to make an organization like theirs effective, how would they spend those tokens? So what we show here are the average tokens allocated. We see that generally senior leadership is recognized as the most important factor / domain in achieving effectiveness, at least from the ED's perspective. And then on average, ED is also allocated almost 2 times more for that, the average tokens for fundraising, engagement, and human resource, which are the top 2 areas. Other areas, however, such as collaboration, innovation, knowledge and risk management, those are rated on the lower end with either 6 or 5 tokens. So we had put the previous findings together on the token, also with the corresponding mean organizational effectiveness domain scores. So what you see in this chart, we had set some thresholds to make sense of the findings where in terms of the token allocation, based on the findings on the previous slide, the slide just before, 8 was the average number, about 8 was the average number of tokens allocated for each domain as a whole. So we just set, we had drawn a line at a 8-point mark, whereas 6 was chosen as a cutoff for organizational effectiveness because there was a positive response will agree towards the various OE statements. So on the top left quadrant, we have over here, we will have fundraising, engagement, HR, strong leadership as areas where SSAs not only allocated higher number of tokens to, but these are also areas that they had lower mean scores on, reflecting their lower self-rated competence. So it suggests that SSAs do recognize these as important areas for improvement that they also want to devote more resources to. Whereas on the bottom left quadrant here, there are several domains such as financial management, collaboration, knowledge management, and risk, as well as volunteer management, where mean scores for effectiveness is on the lower end and tokens are also allocated on the lower side. So these could potentially be SSA's blind spot. But just because an agency put a lower number of tokens in a particular area doesn't mean it's not important for the SSA. So in this slide, we present we had an open-ended question on challenges or opportunities that SSAs think that they'll face in the next 3 to 5 years. So these are coded based on just the verbatim text that the SSAs have provided. And we also see that SSAs have identified collaboration, right? For example, as a future challenge and opportunity. And taken together, the findings of the SSA module, together with other data sources, they have helped us scope the refresh social service sector strategic trust, which launched at the summit earlier this July, as well as funding. It has helped us scope funding also for capability areas under the community capability trust. So for example, in the current iteration, the trust is open to applications for funding to enhance SSA's capabilities in areas such as HR, which was as earlier flagged as an area that's high priority for SSAs, but they had rated lower self-rated competence. Volunteer management is also a key area, right, that SSAs can seek support on in the CCT. So this was an area that SSAs earlier rated lower self-competence, but prioritized less tokens too. Digitalization is also another key pillar now in the CCT, and it's identified as an opportunity on this slide, right, where 36% had, through the verbatim responses, just flagged digitalization unprompted. So the productivity improvements through digitalization as a result do cut across most of these organizational domains. And I believe Bruce will also be sharing a bit more on that later. So in sum, I think we generally encourage agencies to, not only using these findings, but to take the next step really to consider which areas they wish to devote resources to, improving organizationally through the use of the organizational health framework for social services, which Bruce will touch on his sharing. We recognize that every agency has unique needs, and the prioritization of areas of organizational effectiveness will vary from agency to agency. So tools under the framework will help with such diagnosis of what you should really be focusing on within your agency. So before I pass the time to Bruce, if I could also just direct you then to, we have a set of infographic. If you would like to read more about the findings from the SSA module, so you can find it at go.gov.sg/SS21 NCSS, and I believe Suhan will also be circulating this. Additionally, if you have any questions, even if you didn't manage to raise them in this session, or any questions about research resources, feel free to write to us at research@ncss.gov.sg. Okay, with that, I'll end my sharing and then I will pass the time to Bruce. Let me load up his slides. Give me a second. Thank you, everyone.
Thanks, Natalie, and thanks for helping me load up the slides.
Okay, here we go.
Thank you, thanks. Okay, so as Natalie did mention, right, what she has done is really, like a sector-wide survey. And what I'm going to talk about really is the organizational health framework for not so fast.
Yeah, sorry.
Organizational health framework for the social services. And this really, it allows you to look within. Maybe in the next slide, I quote from Carl Jung, right, who is obviously, you would know, a renowned Swiss psychoanalyst, psychiatrist, right? Obviously, what he says here is not applicable to organizational health, right? I mean, he says, your vision will become clear only when you look into your own heart, who looks outside dreams and who looks inside awakes. So what Natalie has presented is a sector-wide view. You can consider that as outside. You can see where the states of different organizational effectiveness or excellence are, and you can have a vision that you aspire towards. But that is a little bit pointless unless you know what's happening inside within your own organization. That's when you are awake, right? And you are able to see how far you can push yourself. So the other analogy I like to use quite often is from a sector perspective, what Natalie has shared could be considered like a PCR, a very comprehensive, wide encompassing and very scientific diagnostics of the sector in general. But what the organizational framework is really a self-assessment, like an ART, where you can take any time. You don't have to wait for the annual survey. You can take any time and see what's happening within your own organization. So maybe next slide will give you an idea. I think most of you in the audience, I recognize your names, may already be very familiar with what this is. So quite similar to what Natalie has shared. It comprises of a fixed number of domains. Here we have 7 domains, stretching from strategy and leadership to governance, people, finances, digitalization, communications and partnerships. That typically also relates to fundraising, right? Which Natalie has highlighted a fair bit, and user-centric services. So whilst there are 7 domains, they are interrelated. You can imagine things like strategy and leadership would be key drivers. You need probably strong strategy and leadership, regardless of what you do, regardless of the nature of services that you deliver. Some are fundamental, things like governance and finances, by and large, the basic and foundation, right? Without which you also cannot render your services. And others like digitalization and people, again, no surprises there. Natalie has already mentioned. These are 2 domains that are key enablers. So the balance is a bit different. If you are a very high touch, super high touch kind of service or program, then perhaps digitalization needs to be a bit more measured. On the other hand, if you are very volunteer driven and not just staff driven, right? Some organizations we know, SSAs we know, are very light and lean in staff, but they capitalize on a huge pool of volunteers. Then under people, the volunteer management domain would be a key enabler. So aside from the domains and the frameworks, there's a self-assessment, there's a rubrics for you to go through. There are also guides. So without being, experts in any of these domains, be it people, digitalization, finances, and all that, right? There are guides that help to get you started. Of course, it's even better if you have the right expertise in-house, but we also understand that a lot of lean SSAs and agencies don't have that luxury. And so this is both an assessment tool as well as a guide for you to get started. So at the end of it, if you do the assessment, you're not just doing yourself. We often invite SSAs to appoint a diagnostic lead to help bring the right people together, most often at the senior management level, so that because they understand the operations and the strategy best, right? And after doing the assessment, you get a score, and that's what you do. So what is the purpose of this, right? All in all, it's not just helping yourself look within your organization to know how well you fare. It's also a common language you can use within an organization to talk to your different stakeholders, your staff, your board members, your funders, because all share the same knowledge or same benchmark of sorts of how to measure the effectiveness of your own organization. That's one. The other use, of course, is to use it as a benchmark. 2 ways. One, you can use it to monitor your own progress time after time. It could be done regularly, for example, on a 12 or 18 month basis, or it could be done before and after strategy review, strategy change, reorganization of sorts, for you to see how far you've gone or either forward or backward. That's one need for it. The other way of a benchmarking is also to see how you fare against a sector level benchmark. We've just started this early this year, about 6-8 months. We have only about less than 50 agencies that have taken this, so we don't have a very robust data set yet. But as the sample grows, we also hope to dissect some of the data, either by SSA size or by subsector or other archetypes that may arise from the data that we see. Okay, so next, if we just use one example, the people domain as example, because Natalie also mentioned that is one of those areas where SSAs feel challenged, but also want to develop, right, the people. So even under the people domain, while it's a high level domain, the next level down, we broke it down to people and succession planning, recruitment, staff engagement, well-being, learning and development, performance management and recognition, volunteer management, and process readiness. So there is a cutoff. I mean, typically just like PSLE, right? There's a cutoff, 70% and above would be good and below would be fair. And you can see, I mean, just by looking at 30 to 50 SSAs that have taken the assessment, I think most of us have done well in staff engagement and well-being because we do focus on our staff despite even the past couple of years where with COVID being a bit challenge and a lot of staff suffering from burnout. But not so much in terms of performance management recognition, and even volunteer management to a certain extent is not done so well. So I'll just share 3 examples just to add flavor to what a number might mean and what the rubrics might mean, right? The first example coming from the next slide would be Yayasan Mendaki, right? Where they have done a diagnostic of sort and know that they need to focus more on people. And with that, 2 things they did. Of course, they know where the gaps are. Is it in terms of culture? Is it in terms of performance review or staff management, career perspectives? And so they've identified those as gaps and intentionally and mindfully design interventions to build those areas up. So things like career development framework or performance systems, they level up in some of these areas. They also focus on the softer side of things like engagement, like town halls, like building relationships and getting the line managers to be more involved in the learning, the development, and culture building of their staff. So as you can see from a lovely picture there, they're all very happy. And I think that has translated quite directly into the improvement in services that they render for their clients. The next example would be on volunteer management. Another Malay Muslim organization, PPIS, where they saw the need to build a very strong volunteer culture. So they typically tap on a lot of volunteers for a lot of their services, and they're a multi-service, multi-agent, multi-centered agency, right? So they relied on volunteers and they wanted to build their culture. They wanted to build a strong pool of volunteers, and at the same time recognize that, you know, the criticality of their volunteers. If they don't, for example, right, if they don't manage to engage their volunteers, or if the circuit breaker was to come around again, if they weren't able to mobilize the volunteers, what were their contingency plans? And they factor that into not just having a plan, but also designing the role the volunteers play vis-a-vis, you know, the paid staff that they have. So again, by doing their diagnostics, they know where the gaps are, they know the areas they need to focus on. And aside from that, they designed intervention plans to cater to some of these areas. And last is an example of digitalization, where CPAS saw the need to ramp up their service delivery. So, and interestingly, they're one of the first few to pilot using a robot to interact with the children on the spectrum and the autism spectrum, right? And you know, a couple of things. Of course, it helps to alleviate some of the workload of the teachers. That's one. But I think more importantly, and you can see that it has increased almost 34 times, right? The client engagement between the students and the robots. I mean, I'm not the expert here, but you know, they do measure, you know, the engagement level and the interaction level between the child and the teachers versus the child and the robot. And you can see, you know, from attention span of 1 to 2 minutes every hour to about 50 minutes every hour. So that's like a 34-fold increase in attention. And that again directly translates to better improvement in the children. Okay, and of course it alleviates some of the workload of psychologists by introducing, you know, teaching aides who can help just accompany the students and the robots without having, you know, to tap on the psychologists, right? So I'll just wrap this segment up before we go into Q&A and the panel. Is by quoting again from Mendaki, which was example earlier. We know that SSAs are often challenged to provide very immediate attention and focusing on the needs of their own beneficiaries. And so it's very natural to overlook the need to focus on the organization health or efficiency or processes capability. So what we're offering, it's like a cheat sheet of sorts to help SSAs enhance their own capability and capacities in a very guided and structured manner. So it becomes an enabler. And then, by just following through, and hopefully it is less painful than it might seem, right? Then they can then use that to achieve their vision and mission by ramping up the different domain areas most, as effectively as possible. Yeah. That's all from me.
Thank you so much, Bruce and Natalie, for your presentations. So before I hand over to Justin, just wanted to share that I will follow up with an email to all registrants containing the links and email contact after this webinar. And also for the Q&A, I will now enable audience to unmute as well as to turn on your cameras if you prefer to ask your questions directly. Yeah. Otherwise, you can also post your questions or vote for them on the Pigeonhole link in the Zoom chat. Yeah, thank you. I'll now pass over to Justin.
Thanks, Jehan, and thanks, Natalie and Bruce, for the presentation and the sharing. I would just like to invite people to, if you wanted to switch on your videos and ask questions, you get to jump queue, because then if you ask questions verbally, we'll go to your questions. If not, we'll kind of run through the pigeonhole. But I wanted to reflect on the sharing thus far. I think it's the survey is interesting in the sense that it's a measurement of the perception of kind of like the reputation that the social service sector has. And so the reputation from the point of view of the public, from the point of view of the corporate funders, and point of view of SSAs themselves. And kind of interesting to see that, well, actually the reputation is very good because, maybe COVID, past 2 years, a lot of people do a lot more things. And the funders have a generally higher sense of the organizational effectiveness of the SSAs compared to the public, which makes sense because, if you're a corporate funder, you will know the SSAs, you'll be funding them recurringly, so you tend to have a better view of them than maybe the general public at large, who may or may not be familiar with the social sector as much. And so, and then what was interesting to me, and maybe I'll kick off with this question, is that it sounds like a lot of the medium to the larger social service agencies are the ones that have improvements or vast improvements in organizational effectiveness. And I wondered whether, because I've wondered whether then the implication is then if medium and larger ones are more effective, does it imply that we should invest in the larger SSAs and less so in the smaller ones, if they are the source of driving this? Because that's always been talked about, right? And I wondered if Natalie or Bruce, you have any views about that, or just the people here in the room?
I mean, speaking from the point of view of the survey itself, I mean, generally the way that we have used the findings is it has helped us identify the main areas of focus, organizational effectiveness, possible domains that we may want to direct more resources to. But honestly, we don't use the findings in that way to say that, this size of organizations would warrant more for resources. But I think in terms of how we make decisions regarding the funding, I mean, Bruce can also share more for the CPT, but typically, I mean, we look at a range of areas such as obviously the needs of the service users also, right? So NTSS has the service funding priorities. So that is always one of the main guiding principles. So not so much necessarily the size of your organization, but more of what kind of gap are you filling in the sector. Then in terms of the capability development funding, I mean, perhaps Bruce, you wanted to share a bit more on the CPT end as well?
Yeah. So I just add on, right? I think while size makes a difference, it may not always matter, right? Because really, end of the day, it's how effective you render your services. And I mentioned earlier, right? Some of the SSAs, they may be very lean, but they tap on a big pool of volunteers, and they're very effective in tapping on the volunteers. So we do measure that as well. I mean, that's different from Natalie's sector survey, right? Slightly. So, but we do measure that as well. So if some SSAs have shown that they actually, I mean, despite them being lean, they actually render the services well. the quality of life of their clients or service users improve, and they are effective in managing the volunteers, then certainly that they are also agencies that we want to build capabilities in. So I give I mean, just case in point, right? Like if they are very good and apt at managing volunteers, but they don't have a volunteer management system, that kind of takes away some of the menial tasks of scheduling and notifying volunteers. Then something like digitalization, we certainly want to invest in those agencies to help them build that capability, that specific capability, which will then help them even more in volunteer management.
Mm. Thanks, Bruce. I guess the implications of the finding are really interesting because it could be if the big ones are driving all the change, therefore we should only support big ones. Or the implication could be the other way. Since the big ones are doing well, we should support the small ones. So the finding is the finding, but the interpretation and significance is always different. Let's go to the pigeonhole. The one with 10 votes is, can we invite an SSA next time to share about how they used the OHFSS and implemented changes? Maybe that's a yes no answer.
The short answer is yes. I mean, unfortunately, we could have gotten 3 of the people that I've quoted examples. I've got to come in and share as well. Well, certainly, if the organizer is keen to do that, we can bring them in. Yeah.
The next question, I wondered if this would be because the survey didn't ask this, but the question is, how many social workers with over 8 years of experience can we expect to have in 2040 to 2050? Will Singapore have enough SSAs that have senior social workers in direct practice, research, and senior leadership? It's not a question that Natalie, you asked in your survey, right? Okay. Bruce, is there any kind of background information you would be able to give input
No,
on?
unfortunately, no. I don't want to be quoted on this, so I have no idea either.
Okay. See all these questions, not asked yet one. See, the 6 votes one is, has the amount given by the general public and funders increased? You didn't ask this. Did you ask this? The specific
Yeah, I
amount.
mean, we
Okay.
do have a sense. So, I mean, perhaps I can comment more on the Gen Pop. We did observe an increase for some categories. So we asked on the basis of different, not the exact dollar amount, because it would be quite hard for people to remember. I gave exactly 550, for example, or I gave exactly $10, right? But we asked based on general categories. So we had the category that saw an increase. I mean, most people gave between $51 to $200 among Gen Pop, and that increased by about 11%, if I recall. But on the whole, if we look at the mean amount, there were no significant increases. Yeah, it was about the same lah. Funders wise, I think we can, yeah, if whoever is asking really would like an answer, perhaps they can drop us an email. I don't have it at the top of my mind now. But it's also to bear in mind that, in terms of like sampling of funders, we're also looking at a particular pool now, right? These are individuals these are corporates who are recalling that they are involved in philanthropy activity. So they may also be more, I would say, as Justin mentioned, these will be funders that are also more in the know of the fact that they're involved in the sector and have a bit more knowledge and understanding. So, I mean, they may not be necessarily reflective of some of the other funders that had not participated in the survey, or some organizations, they may be involved in philanthropy activity, but based on online panel, it wasn't registered as that they had participated. Yeah.
I wanted to add a question to that. Since there was a question asked about whether people donated money through payroll, and I expect this to be the share program whereby a portion of your money is deducted, right? And then the question is like, you never, rarely, occasionally, moderately, or a great deal. I'm figuring if I'm on the program, it just gets deducted. What does it mean to be moderate in this aspect? I just wondered what that meant.
So moderate, we did also specify like time period. So rarely was once a year, and then occasionally it was defined about 2 to 3 times a year. And then moderate would be about 4 to 6 times a year. And a great deal was more than 7 times a year. Yeah.
So there's you can sign up to this kind of program and specify how much of it is deducted, or how frequently is deducted.
I mean, there are a range of various payroll related schemes. So depending on your organization, you would get there will be a, from what I understand, there is a default. But then if you wanted to top up, there will be opportunities that organization might offer to you. I mean, at least as a public servant, we do get opportunities from time to time. We get email saying, would you like to increase your regular contribution? So yeah, that's also how at least I'm aware that I'm even giving this. I'm reminded that I'm giving this regularly.
And this will include the ComChest one as well as the CDSE Mendaki Sinda.
Yeah.
Okay. Cool. The next question we have is, besides the framework and guides, what other NCSS resources, for example, funding for digitalization initiatives, consultations, etc., are available for SSAs to tap?
Okay, I can answer that question. So, I mean, typically, if SSAs want to implement something, they are faced with three broad challenges, right? One is lack of funding, one is lack of manpower, the other one is lack of know-how. So as far as possible, we try to support SSAs in these three areas. So lack of funding, we do have subsidies. So under the Community Capability Trust, or CCT, right? One of the pillars is the innovation and digitalization pillar. So there are tax subsidies, for basic software systems like HR systems, accounting systems. There are pre-scope vendors. If you adopt any of those, we fund up to 30,000 on an 80% sharing basis over 3 years. Second and third year on a 50% basis. So that's the co-sharing needed. So that's in terms of funding. So for slightly more complex ones, the SSAs may say, but I don't know what I don't know. I don't know how to implement a system, how to design a case management system or a client management system, for example. So they lack the know-how. We also provide consultancy support. So there are vendors we also pre-scope and pre-identify. They'll come in experts, a wide range from design to user journey mapping to system architecture or the solutioning to even change management. Or role design, role redesign. So those will be included if those are needed. Those are part of consultancy or know-how. Then, of course, the third point, right? Then how do I have manpower to carry this on? I mean, consultants only come for a 6-month period. How do I continue this? There are various schemes. So, like there was a transformation support scheme where we fund or subsidize salaries for new hires. If you're hiring somebody to do a transformational project over 2 years, for example, to implement a system, we do subsidize those. We're also piloting some like a gig work, like a platform worker, a gig worker in areas of IT, like we call it the IT talent hub. So if you don't need a certain type of skill, like example, like a cybersecurity expert or specialist, right? For long periods of time, you don't need them at the start of the project to do the designing, and maybe at the end of the project to do some testing, and then maybe every year, for a couple of weeks to go and do some penetration testing and all that, just to make sure everything's in order. We do offer such ad hoc part-time support as well. So again, it's co-funded on an 80% basis, 20% SSAs, we provide 80%. So those are different support schemes that NCSS has for, and this is not just for digitalization. So for volunteer management as well, for people practice as well.
Thanks, Bruce. The IT talent hub sounds interesting. The types of IT skills that the hub brings in, and these are, you're saying gig workers, so they would take it on a project basis, and then the SSA
will pay them. We work with an intermediary to help control that pool of different skill sets. So like, there could be project managers, IT project managers, there could be business analysts or solution architects, there could be cybersecurity experts and so on, and cloud specialists. So depending on the nature of the project that SSAs want to embark on, then we'll pull in the right people at different points in time, and then we work out like a roadmap in a 6-month or 9-month period, who's going to come in for how long a period.
And they would be cheaper than market rates?
Okay, so of course, first of all, it's subsidized. So it is for sure cheaper than market rate. But we work with an aggregator, so it is slightly cheaper. But that said, and that's the honest truth, right? The rates are going up year on year. It's unavoidable.
Thank you, Bruce. Next question is, from the survey results shared, what is expected of SSAs to do moving forward? This question is the question mark is asking who does NCSS expect SSAs to do what, or SSAs themselves? I'm assuming it's asking NCSS. Okay, what does NCSS expect SSAs to do moving forward?
I would also invite any of the technicians to share like how do they would translate some of the sharings of the survey to their organization, and what it prompts them to consider within the organization. And as I mentioned, and Bruce mentioned as well, we encourage agencies to take up the tools in the organization health framework for social services. Or even, I mean, even for things like digitalization, we also have diagnostic tools to help you, identify what you could really be focusing on your organization. Because we're not saying every SSA has to allocate the same amount of resources to all these domains, right? You will know what's best based on your client pool and the human resource situation, and then the diagnostic tools are ready to help define what are those areas in your specific context. Yeah.
I suppose now that it's World Cup, I also think that, just like Bruce was saying, the diagnostic tool isn't something isn't something that you use kind of like a fixed template, because if you look at the soccer players, they have evaluation rubrics, right? How your speed, your skills, your dribbling, your passing, your shooting. Then depending on your role, right, your SSA role, you might be a striker, you might be a defender, you might be a midfielder, and that role is different. So maybe an advocacy organization or a organization that just does memberships or community building will look very different from a social service provider. And then, so maybe if a service provider that takes a lot of government money, and if they do not so well on fundraising, that's okay, because then government give money, right? So why invest in that part? And so I'm thinking that maybe that's how we could think about the organization effectiveness framework as something that you use. You look inside, like Bruce was saying, you look inside and look outside. Then you look inside already, you figure out what your strategy and identity is. Then you go to Bruce and do the do analysis, ask for money, ask for manpower, etc. I actually wondered though, at the higher level, then is there a sense of what kinds of organizations should do well in what aspects? Is there a sense of that from your thinking so far?
I think the other framework that we often quote is the 4ST, right? The Social Service Sector Strategic Trust, right? Wow. Okay. Yeah, so that's the often quoted framework where the whole sector should strive towards, right? Don't ask me what the 4 trusts are, but I know some of them. Obviously, you focus on the user, you focus on effective social purpose entities, you focus on the community, and then the new trust that was introduced this year was the future ready organizations. So again, of course, there's a period of change, and I think at no matter what kind of service the agencies provide, of the day, I mean, if we all strive towards that goal, the 4SC, the 4 different strategic trusts, those would be areas that I think would be the guiding principles or guiding light in that sense. Of course, the house could be quite different. The exact what's to focus on will be quite different. But end of the day, we've all focused on these 4 areas. That should be, I think, where we would like all agencies to strive towards.
Does anyone from the participants want to respond? Does that answer the question that you asked? Okay, if not, let's go to the next question, which is, what's the reason for including only EDs or CEOs for the survey and for not including HR practitioners or other staff for the survey? It's a methodology question.
Yeah, I'm happy to take this. So I think in terms of the nature of the questions that we had asked, we felt that at least senior management would be the most appropriate to answer given the broad range of the questions. So we didn't want a situation where someone was asked to do the survey by their boss through nomination, and then turns out they are only familiar with one aspect or 2 domains, because these domains do cut across quite a lot of departments in SSA. And so for that purpose, we had focused at least on senior management. So we had asked EDs to nominate senior management that they also wanted to support in completing the survey. But unfortunately, the take-up wasn't amazing, and then we had, for sake of ensuring that representativeness in the analysis and all, we focus on the ED responses. Yeah. Actually, there was also a question on about including. Okay, so I answered on the why not including other practitioners. I think also just to flag that for other studies we have also sampled staff or SSAs or professionals from the sector lah. So for example, during COVID we had run a poll also on the perspectives of our social workers and the social service professionals. So there are other opportunities that other platforms that we have sought to seek practitioners' views. Something I wanted to raise was I thought it was interesting because like we in the GenPop sample, right, we do actually have a sizable pool that of service users, or rather of individuals in the GenPop pool that have been exposed to services, meaning that recently they have been service users. So I was surprised that actually we didn't really get questions on that, but I thought to maybe just share some of the findings we had on that. So based on the analysis, differences between whether you're a service user or not, there were a few types of questions that we would see significant differences. So for example, in the question about involvement in the sector, right, meaning the donation through payroll or volunteering, I think it's not surprising that actually service users, which we had about more than 700 actually in this particular sample, that said recently they had been involved in or received services from social service agencies. They had significantly more involvement. So volunteering, for example, 31% of those who use SSA services of that pool had volunteered regularly, meaning at least moderately or a great deal, right? Which was about at least 4 times a year, right? Compared to those who had not had that contact, 7%. Yeah. So just to also encourage agencies that I think your service users do feel the impact, and then it actually drives them to contribute back to the sector as well. Another one that we saw, another set of questions that we saw difference was perhaps in their general perception. So there were a few items that service users had a more positive perspective compared to those who are not service users. Naturally, the item that SSAs are effective, also the understanding that SSAs have governance structures to prevent fraud, perception that SSAs are reliable, SSAs provide better services than informal services, the informal organizations rather, and the SSAs are trustworthy. Another one to flag was also that this one was just interesting, like it was just for us to sound out like of how do people perceive organizations' membership to NCSS. So we saw that among those who use SSA services, they actually were more likely to trust an organization if they were members of NCSS. So just to share the SSAs for SSA's interest, the perspective of service users.
So that's kind of interesting, right? So for the general public who has some kind of interaction with SSA before taking a service or what, they tend to have better opinions about the SSA rather than the general public. So, and they also volunteer back because there's kind of reciprocity there. That's very cool. The next question we have is there a way to measure retention of social work practitioners and reasons why there are very few senior workers left in the sector? It would be good information to inform people and practices. Natalie, are these questions asked in your survey, or maybe the implication is, would you consider asking questions like that in the future?
About retention in the sector, is that? I mean, to the extent that this was a question to the EDs, yeah, I mean, that's something to consider in the future to ask about, what's the experience in terms of retention rate from the organization's perspective. Yeah, that's something for us to take away as well.
Okay, but there's no, currently it's not asked this, okay.
No, yeah.
Actually, IPS did do a survey of the SSAs in 2017, 2018. So, you got 149. We only got 107. It was so difficult, and we basically gave up. So this is kind of a response to the question of who do you survey and why, right? And we went the easier route. We went, okay, ED or whoever ED appoints as a proxy to answer the questions. And even after the RA call and remind people, we only got 107. And so I think while it would be nice to, people think, you should survey the whole organization, get views from different parts of the organization. It's just really difficult in an actual project you want to implement properly. And I think after I did the survey and decided, do I do this kind of survey anymore? So kudos to you for continuing to do this. But in response to, there are a lot of people asking questions like, they have a lot of questions that they always hope a survey instrument can answer for them, but are eventually not included. And after we did the very difficult and painful survey, I thought to myself, and I wonder what you would think of this. Why don't we just crowdsource the survey questions? Let people suggest questions, they upvote the questions. The most upvoted questions gets into the survey instrument. And I wonder what you thought of something like that.
Yeah, that would be very cool. I mean, I think we always invite, agencies if they're interested, like after reading this, to drop us an email if they think that there are specific areas that they had hoped we could dive into. And then our team honestly is quite small, so we're likely to we usually we do document these and then we can bear it in mind for the next iteration. Yeah. So we invite any of the agencies attending today, if you think there is something glaringly missing, just shoot us an email. Yeah.
Yeah,
I'll type it in the chat.
Yeah, just add on. I mean, there are questions that sometimes need not be answered by surveys, right? And could be answered by big data. So I think the earlier question on retention of social workers and all that. I mean, if you want to just measure retention, we can do it through, MOM or one of those like CPF data. Of course, if you want to know why they are leaving or why they are staying, of course, that has to be done through a survey, but otherwise, that's one of those things. The other thing is because we have some of these indexes, right? Like People Practice Index or Digital Acceleration Index. Some could also, instead of tapping on this big nationwide survey, can also be delved into by some of the more niche or intentional surveys that measure some of these things. And those can then be reflected back to the higher level.
Yeah, even when we were designing our own survey, we looked at all the surveys that different types of membership organizations were asking, and it could be very when you want to capture something, it could be very detailed. Like there was a survey just to understand the evaluation capabilities of an organization. So it'd be fine grained like that. And when we asked our survey, we are of course interested in the research kind of capabilities. So we asked, like, do you care about needs assessment? Do you do it? Do you care about program design? So it's always hard to try to, surveys can never make everyone happy, I suppose. And it depends on how fine grained you want to be. We have another question for, this one probably will be taken by Bruce. You basically got money, right? They got money to support collaboration. I'll read it. I'm saying it badly. How likely are we to see more funding in the future that are geared towards collaboration across multiple SSAs? I appreciate there is such a component in the CCT and hence wondered if it will be scaled up.
Oh, there is. So yes, the future is here. So under CCT, there is open, what we call the open grant lah. So we do encourage collaboration. So the open grant funds things that are not so clearly defined, right? Also, is it digitalization? Is it people practice and all that? Not so clear. So that's the purpose of open grant. It funds things like that, not so well defined. But there are two levels. So if you are implementing something for yourself, then the funding cap is a bit lower. Whereas if you're working with another agency to implement this together, even if it's a system and it's because it's a shared system, because the economies of scale, there are, like you say, crowdsourcing, right? There's a crowdsourcing of ideas and features and all that. The funding cap is higher. So that is from a capability building standpoint, right? From a program standpoint, NCSS announced the 4ST Partnership Fund, I think at the summit this year as well. While the details have not been announced, in terms of mechanics and the funding parameters and quantum, but the intention really, again, is to encourage collaboration. So if SSAs come together to design a new program or a revised program for better service user outcome, then those programs will be funded as well.
Just earlier today, a colleague from working in a SSA was saying, I got into this conference, but my organization got no money to send me there, and said, couldn't you apply to NCSS? Does it qualify for?
You mean for SSA staff to attend conferences?
Yeah, for an academic conference.
Yes, there is. I think professional, capability grant. That's the one.
Okay, cool. Let's see. Next question is, in the area of research and evaluation, can you elaborate on the funds and resources available for capacity building in this area? understand that it is one of the CCT pillars, and how does it work?
Yeah, I think I'm happy to share on that. And actually, I also wanted to perhaps respond to one of the questions I saw about other initiatives as well that, with by NCSS that they can leverage to collaborate with other SSEs. So maybe I'll share a bit on the research resources bit, and then just signpost also to something that I'm aware that's happening on that collaboration front. So general research resources, I think actually I shared the slide earlier, but of course I don't think it's easy to read in such a short time. But broadly, that I think over the past few years, the PSRD has been functioning. I think we tried to understand the different range of needs that SSEs have along the evaluation and research journey. So it's not just at the point of data collection. I think it really starts from like understanding like scoping of the research problem and understanding like, who is ready to benefit from this research, right? And I think at the end of the day, we ultimately want to focus on research that can benefit service users and also enhance the general knowledge in this particular field. So enhancing the state of understanding in social services particularly. So we do have a few resources in terms of at the early scoping stage, ranging from a free journal access, and we had also launched the social service research repository. So again, I will let Zhihan know the link that you can view the list of these resources. And again, the email of my team is stated here if you have any questions about and you wanted to talk more about any of these opportunities. Moving on to, let's say the data collection process or even planning that, right? We do have a volunteer research matching service, and we also do try to link SSAs up with, IHLs or even SSR here, right? Our colleagues at SSR to support lah. On the other front, we also look at specifically evaluation, right? So some of you may be familiar with the sector evaluation framework. So we do, myself and a few other colleagues, we do focus specifically on the research and setup required for evaluation practice as well. So quite a wide range recently. And then in terms of overall, research practice, we do have, we recently launched the ethics review committee. So as many of you are aware, I mean, there was previously the AIC option in terms of the IRB, right? And then agencies will also could possibly have also approached, Parkway or some of the other private sector options. But we have also recently launched our own IRB for benefit of SSEs. So they have a wider range of options. And also we do try to, I think the benefit of having an IRB from the sector's perspective is that we're not thinking biomedically. I think if you're aware in terms of IRB, quite often, Parkway or some of these other providers, they may come from the biomedical point of view. We come from more from the social sector point of view. Yeah. General data wise, we also have a dashboard. So recently we had launched the caregiver, some of our reports recently had come out, such as the quality of life of children and youth under 18, quality of life of caregivers. And I believe we also have a caregiver data set coming out as a dashboard for public access. So some of these will be available on that link that Zhihan will share as well. Yeah. If I can also point to the resources or rather the opportunities for collaboration with other SSEs, and if Bruce also wants to share more, feel free. But there's also an initiative called Capability Circles, where we do gather SSAs on periodically on some key topics. So actually we're in the process of organizing one now, pending, I guess, Bruce's side confirmation also. We will be focusing actually on evaluation and also service standards in the upcoming capability circle. So it will be a gathering of SSAs who are interested in working together and understanding each other's practice in a particular area of organizational effectiveness. And the upcoming one will be looking at user-centric services, likely. Yeah. So SSAs can expect an invitation soon. It'll be sometime in February.
Well, thanks, Natalie. I think you said it all. It's very good when other people talk about my programs as opposed to me talking about them myself. So yeah, I have nothing to add to the capabilities.
Is it a kind of like a community of practice, and is the scope defined as you send out? Can people also suggest things that they're interested in?
It's loosely, I wouldn't call it COP lah. But what we try to do is we try to structure it according to the domains in the organization health framework. So like research is one of them, user-centric services is one of them. So that's a systematic way of covering as many of the areas as possible, and obviously prioritizing those where we see either bigger gaps in or stronger drivers in. Yeah.
Thanks for clarification, Bruce. Naturally, good to go back to your volunteer matching. I'm curious because some of the SSAs have research teams, so they're probably fine. But then some, maybe a practitioner wants to do some research and they feel, well, I got my casework, I can't spend much time. And then if they approach you, is the idea then that you will match this person up with a researcher who's a volunteer, and then what? First, maybe how does the matching work, and who do you identify, and do people have to consent to it and all that? And then after people are matched, what's the expectation? How long projects are, all that, and all that.
So the pool of volunteers, I mean, initially it started out with researchers who are actually in the public service. So some other public servants or civil servants who are in our network that we know are keen to support social service agencies. So they had entered the pool. So it was really based on whether or not those departments were interested. But gradually we also added some teams from IHLs, like groups of master students, depending on the prof interest and that team's willingness as well lah. So it's very much like, I mean, as with any volunteering, it's really up to the volunteer in terms of their commitment, right? But the minimum commitment, from what I understand, is like it'll be a 6-month period first. So the matching service, I mean, we do link them up, but it will be, we do set up opportunities for both sides lah, to understand what are the expectations, and also to kind of scope the project such that the involvement of the volunteer is meaningful for the team. So since these are career researchers, typically the advice they tend to give, it will not be as much on the let's say like churning the transcripts from, let's say, an interview set, because I think that actually in itself doesn't necessarily require a specific research skill set. That will be, you can hire temps for that, or can seek like RAs and other forms of volunteers, but they do try to give more specialist advice, in terms of, let's say, sampling or thinking about how you can set up like a questionnaire, for example, what would be some best practices, and then also even looking through the research plan. So I think previously there have been requests also in like advice on IRB and things like that. So quite a wide range, but we hope to focus it more on like any specialist advice related to research that will be of use to SSA. Yeah.
And if SSAs had a research proposal, let's say they drafted something and wanted somebody to just take a look at that, and then they email Natalie Chia, then Natalie Chia will say, well, no, cannot. Or you will say, yes, we are happy to look at it, or we will just point you to a volunteer.
I think currently, I mean, the way it works is also quite hard. I think SSR also gets their fair share of similar requests. I mean, agencies were very happy to have agencies email us and say like, oh, we're developing this project, like, what do you think? So that already happens. And then we think if on our end we're not able to answer it, or like we think that it could benefit from someone following the agency even more closely than just like a few replies on the particular document, then I think that's when we will also direct them to a volunteer that can accompany them more lah. But usually usually our team will answer any of these queries like on research design and all that, have done so over the years.
Thanks, Natalie. Okay, there's one 8-vote question which is about the same lah, it's a bit of measuring how many social workers are left in the system, so we'll skip that one. We'll go to the one on, there are large amount of funding given to larger SSAs. The challenges are obviously different from smaller ones. Shouldn't NCSS fund manpower plus innovation to small SSAs for new insights instead? This is a question about...
I can answer. Yeah.
Okay.
Can. Okay.
Yeah.
So at least from a digitalization standpoint, right, we are quite agnostic lah. I mean, it's open for all, and people, I mean, anybody can apply, right? But from our observation, I mean, it is true. From our observation, not say most of the funds, a large part of the funds, right, or I should say, the bigger SSAs have a bigger capacity to soak up more of the funding. I mean, precisely because they have more resources to start off, right? And they can do more concurrent projects and all that. So, just in terms of digitalization, they could do either, 2 concurrent system implementation or one after the other lah. So just naturally, they have the propensity to soak it up lah. So not saying that, we intentionally fund the bigger SSAs, but just happen that it is what it is lah.
Okay, so I guess the implication of the question is if the large ones can soak up the funds, then the small ones are left to struggle because they may not even have a team to even set, apply for a proposal. Then is there, can there be an idea on how to support those that may quite deserve this, but just don't have that capacity to absorb
Okay.
them? How?
So two parts, right? One is capacity to run the projects, right? Okay, so we do, I mentioned earlier, we have some manpower teams, the IT talent hub, the gig workers and all that, those will help. But the first step to that is the application. And I think that's what you were alluding to. Even application-wise, some of the small SSAs could be struggling. Because quite naturally, the big SSAs either have dedicated personnel to even just do grant applications, or they are just better at it because they're more experienced in it. And it is true. So a lot of the time, unfortunately, right, even for my team, to answer queries and handhold SSAs in terms of the application and grant application tends to be the smaller ones. We do hope, of course, it catches on after 1 or 2 rounds, after the training wheels, they're able to do it themselves. But then we also, again, the reality is that we also struggle. Then there's turnover, and then the new person they hire hasn't applied for any grants before. And so that is a constant struggle. And the next step, what we're trying to do is to provide as much self-help modules as possible. If there are guides, videos, screen captures that ease that application process, we try to do that. So it's more painless for both parties. Even the first step to funding is actually the application.
Thanks, Bruce. Let's see. The other question is about what are some of the causes that are growing popularity. That's not part of the questions that you asked. Were they, Natalie, on what social issues are becoming more critical according to the EDs?
Yeah, we actually had, it's just that, in interest of time and just to frame the discussion more on the SSA module, we weren't able to run through that. If I can share, let me just pull up those findings on the causes, main causes. Okay, so I would say broadly, we had to look at the SSA, the funders versus the public differently, because they will have different areas of interest. So for Gen Pop, in terms of what we saw increasing interest, children and youth that had a significant increase by 7%, in terms of the percentage who would support. I'm just looking at the results now. Environmental conservation actually had the highest increase, which was 11%, and then it does track also now with increasing conversation on environmental issues, interest in COP, etc. Funders wise, we only saw movement for some areas. So environmental conservation was also one area of increase, as well as humanitarian aid, but there were some decreases, some drops in general funding for children, youth, elderly, and community. But it doesn't mean that this was more about that. The question was, which of the following social causes do you or your organization currently support? It could also just be a reflection, of some funders consolidating in some particular funding areas. So as in over time, we might have seen that particular foundations may lean towards particular causes more. So it could also be a reflection of some of those trends among funders, which we won't be able to have a deeper insight on at this level. For interest also, in terms of the types of organizations that Gen Pop or funders might give to, we saw growth in giving to SSAs, but also giving direct to beneficiaries and to social enterprises. And I think this tracks also with what we saw in COVID, since this study happened during that period. Definitely more initiatives, like informal initiatives, coming out also to give direct to beneficiaries and also social enterprises. Funders, we saw primarily increase in giving to social enterprises. Yeah.
Thanks, Natalie. Time's almost up, so I wanted to see if Jihan wanted to end. But before that, you're sitting on like a wealth of information, but then your slides only share through SSR, right? So I'm wondering whether in the future you make some of this available in some form on your website or something, or is the slides what you will share and that's it, or you will do more?
So as I mentioned, there's the infographics that you can see further details on the social service agencies module. but we do have plans to publish it as a dashboard, but that will be pending. We have to make sure that that the dashboard functions well first. So give us some time. That's something we could potentially expect. Yeah. I think, but at the end of the day, like in terms of this current wave of the survey, I think we were very much focused, especially on the organizational effectiveness aspect. Thus the focus on SSA module, and then also showing how agencies can take action through the OHFSS.
Okay. And maybe Bruce, any last words before we pass back to Zhihan?
Yeah, I encourage everyone in this webinar to do that OH or the All Health Self-Assessment. I mean, the data helps you, the data helps us. So hopefully, the next time Zhihan invites us back to this webinar, right, we have more insights to share, and there are enough data for us to dissect it even further and make sense for the participants. I think that's what I really hope to see by the time we come back again.
Thank you, Bruce and Natalie. Over to you, Zhihan.
Thank you so much, Justin, Natalie, and Bruce, as well as the audience for your questions. So I'll quickly launch a feedback poll. Yeah, please tell us what you think about the webinar today. And let me share screen. Okay, so yeah, I'd just like to share the next webinar. Yeah, which is we have also invited NCSS, but with different speakers who will be sharing also their latest findings on the quality of life of children and youth in January next year. Do sign up for our mailing list using the QR code on the screen to receive regular updates on our upcoming seminars, training workshops, and other events. Yep. So yeah, I wish to extend my appreciation to Justin for moderating and providing your comments for the session today, as well as Natalie and Bruce for your time and for answering the audience questions from Pigeonhole. Yeah, thank you so much, everyone. And we have come to the end of the session today.
Yeah. Bye.
Thanks, Justin. Thank you, SSR team, and thanks, Bruce. Thanks, everyone attending.
Thank you.
Thank you.
Thank you.